focus on the coronavirus pandemic now. The Western Cape has been giving a briefing this week saying it's likely to have seen the worst of its outbreak there. It had in the last few weeks overtaken Gauteng as South Africa's epicentre of infections. Let's get an update now with the Premier for the Western Cape, Winde, joining us from Cape Town, I believe. Premier, always good to speak to you. So is the worst truly over for the Western Cape?
I'm not going to say that it's truly over. I think we are in that peak right now. We've got 41,900 active cases. Our preparedness, we're okay still. I've got 88% of our hospitals are full, 29% taken up with COVID-19 patients. And we're sitting with 3,780 beds at the moment taken up with COVID patients. We still have some capacity, but I want to say that we're at that peak. So, at the same time, I'll say we've got capacity in our hospitals, but it also means that citizens have still got to play their part to make sure we're flattening this curve, because it can top it over quite easily. Our extra field hospitals, we've still got 2 wards that we haven't opened yet. But I don't want to open them. I'd rather not. And so it is getting behavior change right in balance with us sitting at the peak.
And how much capacity would those 2 wards, yes, you don't want to open them, if you were to have to open them in the worst case scenario, how much space would they give you logistically?
So I've still got some space in the Brackengate Hospital of Hope. That's a 330-bed field hospital. We're sitting at 274 at the moment. Then I've got Frisia and Ward 99, so we're looking at another 100, but we could squeeze to 150 extra beds. So we have got some capacity, but as I said, I don't want to open up those, we don't need to open up unnecessarily. Mm-hmm. And of course, the big issue for us is balancing the trauma wards, because it's those beds that are at capacity. Those are the beds that are really taking strain. So we are really saying to citizens, you need to play your part, and we don't want you to take up a trauma ward this weekend. Make sure that you are responsible, especially when it comes to alcohol use.
You're worried about a surge in trauma cases linked to alcohol, as you say, because this is a long weekend. We've done the lockdowns now and the restrictions on the sale of alcohol for over a year. Why do you think it is that as soon as alcohol is available, we go back among citizens to the same patterns of behavior, even though we know what happens?
Correct. And that's the big conundrum that, we are asking ourselves. And as a government, our job is regulation, so we can write laws. But at the end of the day, it's also about citizen behavior and getting the behavior change right, getting to understand why is it that, some people believe that binge drinking and then getting behind the wheel of a car. And we've got to make sure that we get away from that. I've asked our MEC, Minister Albert Fritz, to make sure that we've got extra law enforcement between the city of Cape Town and our municipalities, traffic law enforcement out to police, also the weekend mainly, around drinking and driving, also making sure that citizens do respect that our healthcare workers have been at the forefront for a year and a half now, and it really is distressing for them when you add to their burden by putting trauma cases over and above the COVID-19 cases.
And in the presentation yesterday, the weekly briefings by the Health Minister and the team of experts, Professor Glenda Gray was saying that we've seen a reduction in severe illness and death among healthcare workers who've been vaccinated. Do you think that's been largely beneficial in Western Cape hospitals?
Yes, absolutely. You can see it in our weekly Digicon that we put out as well. You can see we always put a slide up with the numbers of our healthcare workers. You can measure them in the first wave, infections, hospitalizations and deaths. You can see it in the second wave, and you see an absolute change, because, the healthcare workers, the frontline workers, were the first to be vaccinated. So you can definitely see the impact of the vaccinations on the front line. And, of course, we're starting to pick it up with citizens, and especially the sort of 60 and over that have been vaccinated, especially if they've moved past the 3 and 4 weeks since their second dose. You can definitely also see much less in infection, and then definitely hardly any hospitalization or death.
You'd set yourself a few weeks ago a target to roll out about a million shots, put 1 million shots in people's arms for COVID-19 vaccination. But you also have an issue about low vaccination levels in areas such as Mitchell's Plain, for example. You were there, I believe, about a week ago yourself to get your vaccination done. Are we seeing an improvement in that situation?
So we're trying nuanced approaches, using community leaders, faith-based organizations, setting up pop-ups. So we'll go into a community that perhaps is lower than others with a pop-up station in a retail store or at a SASSA office or SASSA queue. We've got mobile systems now as well in a bus that moves around. And we've got private sector partners who are also putting up almost sort of mobile containerized vaccine sites. So they'll move to a space to get those numbers up, and then we'll be able to take it down and move it somewhere else. So we really are, and we've got a dashboard. People can go onto the dashboard on our website and see exactly what the registration looks like by age group and pick up those areas where the registration and vaccination is low. And that's why we as a government are zooming in on those areas specifically and also engaging with communities differently, because perhaps a community, for example, say Mitchell's Plain, might be different to maybe someone in Beaufort West, and so we're trying to pick up those nuances. What are those levers that get people to understand, be able to ask the questions? People also have some hesitancy. They want to ask questions. We must be able to put the facts on the table so that they can make up their mind.
And on the nuances, what have you found to be the issues that are keeping people away from vaccination?
So sometimes it's been asking questions about it. There's been quite a lot of fake news about microchips and all sorts of things like that. I think now that people can see the data, and I think also the way that doctors and our frontline nurses are speaking about they can actually see it. They can see the result. That is helping. And I think also you're finding that perhaps someone who is maybe a little bit older are now feeling a lot more comfortable because maybe someone who's a bit younger in the family is saying, well, come along with me. So we're seeing a little bit of take up there as well in those low registration areas. But those numbers are coming up nicely. But still, Mitchell's Plain, which is sitting at 33 and 35% compared to, say, some parts of the Overberg or the Garden Route, which are sitting at 60 and 70% take up in, say, the 60-year-olds and above. So you're seeing regions almost competing with each other. And then, of course, we need to zoom in on the regions that are falling behind.
And at the beginning of the pandemic, Premier, we used to have sort of roadblocks between provinces to monitor people for COVID-19 symptoms and indeed those who were positive, right? How much of that is still happening, especially for a province like the Western Cape, which is a tourism hub, and you've got so many people moving in and out who aren't from the province?
No, we don't have those kind of controls in place. But what we do say is, please, you're welcome. Just adhere to the rules. So make sure you avoid congested areas. Make sure you're wearing a mask and sanitizing. And I mean, everybody knows what to do. And I think those tourism towns specifically, I mean, they know that their success is determined by how they behave. So they're very strict with regards to their rules, in their establishments. And so far so good. We have got, if you look at the data from movement that comes through Google or through our cell phone companies, looking at the big data, I mean, in general, this province has very good adherence to the regulations, and that's appreciated. That helps us flatten that curve. Luckily, our curve at the moment in the second wave has not gone above the first wave, which was what is experienced in Gauteng. So we've still kept it below it, and that's why its behavior change is critical, that we keep it flattening. We keep flattening that curve as we move on for this next week. And then I think by the week after, we can already see hospital bed numbers in the private sector. Those numbers are definitely coming down. The public sector are a bit up, but we're projecting that it'll follow on it. So if everybody plays their part, we will start to see us coming down that other side within the next sort of 7 to 10 days.
And in terms of tourism, yes, as a big money income generator for the Western Cape, are you hopeful that you'll have a better summer this year, especially with South Africans now being vaccinated and hopefully international travel likely to open up?
Absolutely. I mean, the jobs and the livelihoods that have been decimated because of the lockdowns and this pandemic and the lack of international travel. I was in a small tourist town this last week, Franschhoek, and it's devastating to walk up and down the road and see empty shops, empty windows, because those businesses have folded, they've gone. And they relied specifically on international travel. The local travel is okay, but it's mainly weekend travel, so it's not sustainable, and all of those jobs are now lost. There's only so much that you can claim back from UIF and TERS, and there's only so much that will keep those businesses going until they've got to foreclose. They can't keep their loan payments going. So it is very difficult, and especially that SMME sector, which is the majority of the businesses in our region are SMME businesses. And so it is critical that we get the vaccines right, and we get that done and dusted, that we get the borders opened, that we also create an open market for South Africans and sub-Saharan Africans to travel, so the tourism side really does keep going, and it is critical. They could not maintain a second season and not be open.
Now got a new tourism minister as per the cabinet reshuffle, Lindi Sisulu. There'd been a period of uncertainty because the minister Mameloko Kubai was then taken to health to act in that position. Is Lindi Sisulu, the new tourism minister, someone that you as the Western Cape will be wanting to speak to with some urgency?
Absolutely, and the real thing now is, so as a country, how are we getting the regulations in place, the open borders and the marketing to our markets to say this is where we are with the pandemic. We've successfully gone through a third wave. This is what our vaccine rate is and what our projections are, and when we will get to the vaccine levels that are seen as safe for travel. And this is how our border operations work. And of course, these are national agreements between other countries and regions, and we need to get those in place as soon as possible, because it takes a while, because people need to think about the future. And so if we do it now, people will start to make up their minds about traveling at the season time, which is when we need to be open and get those jobs back again.
Winde, Western Cape Premier, good to speak to you, sir. Thank you for your time.